Magandang araw po muli sa ating mga classmate. Magandang araw, Doc. Ang ating pong topic muli ay ang ito po yung kung ano yung blood stasis. So pag may blood stasis po, ang makikita po natin ay mga purple na color tulad po nito. Purple or dark color, example, dark complexion, yung maitim. Nangingitim po siya. Purple lips, purple nail, pag tinignan natin yung kuko, talagang purple. Tapos yung pag may bleeding po with dark blood, makikita natin itim yung dugo. And dark clots. So pag nag-mens po, dark din po yung menstruation ng kulay ng dugo. Makikita natin na may mga maliliit na dark talaga. Pag tinignan natin ng dila ay purple tongue. So yung pulse qualities po ay associated with blood stasis are wiry, choppy, or firm. Yun po yung makakapan natin. Then yung mga organ pong mostly affected ay liver. So, liver po. Then, followed by heart, lungs, stomach, intestine, and uterus. What happened? Saglit daw ko at naglulobot ako. Anak, dali, nalobot ako. Help. Okay po. So, yung blood stasis po ay while stagnation causes distension. Pag may blood stasis po, ito ay causes ng matinding sakit. So, also occurs without causing pain. So, bigla na lang merong mga stasis po, wala muna tayong mararamdamang pain. Pero pag diniinan po natin to, masakit po to. So, pain from blood stasis is typically stabbing. Parang yung sinasaksak, may mga masakit. Fixed and boring. Stasis of blood. So, dark complexion. Summary po ito, ano? Kung titingnan natin yung lips, ay purple lips. Pain, which is boring. Fixed and stabbing in character. So, yung mga abdominal muscles po, do not move. So, pag may nakapatayo, hindi nakafix po yan. Then, titingnan natin yung nail, purple. Bleeding with dark blood and dark clots. Painful period with dark clots. Purple tongue. Wiry, firm, or choppy pulse. So, yan po yung mga sign of stasis. So, pag sa liver po ang blood stasis, makikita natin ang purple nails, dark face, painful period with dark menstrual blood, with dark clots, abdominal pain, menstrual pain, purple tongue, especially on the side. So, titingnan po natin yung tongue ha. Then, yung kanyang pulse ay wiry or firm. So, pag sa heart naman po, may blood stasis, ito po yung makikita. Purple lips. Ganun din po, stabbing or freaking pain in the chest. So, parang sinasaksak masakit. Mental restlessness. Yung tongue po niya ay purple on the side. Towards the front, kasi andun yung sa tongue, sa unahan ng ating tongue ay heart. Purple and distended veins under the tongue. So, pag pinabaliktad, pag inano po yung tongue niya, makikita natin na purple. Then, choppy or knotted pulse. Pag sa lungs naman po pumwesto ang blood stasis, makakaramdam po siya ng feeling of oppression of the chest. Coughing of dark blood. Yung tongue po, purple on the side, towards the front part, dun sa may part ng lungs. Purple and distended veins under the tongue. Pag si stomach naman po may blood stasis, magkakaroon ng epigastric pain. Then nagkakaroon po ng vomiting of dark blood. Dark blood in the stools. Tongue, purple in the center. Pag sa intestine naman po may blood stasis, makakaramdam siya ng severe pain, dark blood in the stools. Pag sa uterus po, may blood stasis, so painful periods, yung namimilipit talaga yan. Menstrual pain, Pag nag-mens na, dark po yung mga lumalabas. May mga dark clots. Tapos meron po siyang amenorrhea. Fix po yung abdominal masses. Purple tongue, wiry or firm pulse. Madali naman po siya tandaan. Blood stasis, in contrast to chi stagnation, which may not cause serious biomedical disease, blood stasis is potentially cause of serious diseases. Example, cancer, abdominal masses, myoma, endometriosis, yung parang ano po ito, doc, yung disease siya na which yung tissue similar sa lining ng uterus, then grow outside the uterus, ito po yun. Tapos yung heart disease, stroke. So yun po yung mga sign. So, does not arise directly as a result of a theological factor. No emotional state leads to blood stasis directly. Some will do so after first causing chi stagnation. So pag nagkakaroon po ng chi stagnation, then nagkakaroon sunod ng blood stasis. Pag pinabayaan. Blood stasis derives from other pathological condition. So pwede pong dahil sa chi stagnation, dahil hindi nga nagmo-move yung chi natin, hindi rin magmo-move yung blood, kaya nagkakaroon ng stasis. So pwede rin pong dahil sa cold, sobrang lamig, sobrang init, heat, or kulang ka ng deficient sa chi. Ganon din po pag blood deficiency. At ganon din kung may phlegm. So blood stasis may cause the following pathological conditions. Pwede rin sa heat, dryness, blood deficiency, chi deficiency, or may bleeding or hemorrhage. So yung clinical note po nito, general points for blood stasis are bladder 17, mga special points po ito, at itong spleen 10. Yan po yung ating tutusukan. So ito, summary po, causes of blood stasis. So ulitin po natin, pag may chi stagnation, pag may cold, heat, chi deficiency, blood deficiency, or may phlegm. Ang consequences of blood stasis po, pag may heat, dryness, blood deficiency, chi deficiency, or bleeding. So, yun po yung result ng pag may blood stasis. Thank you po.
Thank you very much, Ma'am Mildred. We'll now proceed to tongue diagnosis. Okay, our topic for in tongue diagnosis is uneven sides of the tongue or swollen on half of the tongue. This is a continuation of last week. Okay, so we have cases. Okay, we have here the tongue of a 50-year-old female described as pale red, slightly swollen. And if you notice, half of the tongue is swollen and the midline has shifted. Coating is thin and wet. Symptoms, morning stiffness, joint pain upon exertion, pulling sensation and weakness in the left thigh, spasms in the calves upon exertion and exhaustion. Western diagnosis is multiple degenerative joint disease. Background, injuries to a car accident 2 years ago and overwork. So TCM diagnosis, spleen chi deficiency with accumulation of dampness, lack of nourishment in the channels and collaterals due to chi and blood deficiency. Because if you notice, the tongue is pale, and accumulation of dampness. So case history. This is a new patient, no? We have a 30-year-old woman who complained of persistent fatigue and constant colds that always left her with a runny nose, nasal discharge, copious, thin, and white. Left half of her body felt weak. Despite all of this, she forced herself to complete a daily exercise routine, which took up to 6 hours. Grabe naman exercise to, no? Because she was preparing for an important dance competition. She took great care not to gain weight, So this resulted in irregular eating habits. She felt that the food was not being digested properly, as she often experienced fullness in the epigastric region after eating. She felt cold very easily. Tongue body was pale and showed unevenness on the sides of the tongue, pulse slippery and frail. The fatigue and feeling of cold, this were the direct result of spleen-yang deficiency. So we all know na pag may spleen-yang deficiency, this is actually composed of spleen deficiency, spleen-chi deficiency, and feeling cold, caused by excessive training routine and irregular eating habits. The pale tongue, swollen in the center and side, supports this diagnosis. In general, damp phlegm is the result of an underlying spleen-yang deficiency. So nanggaling po sa spleen-yang deficiency yung damp phlegm. And this prevents the spleen from properly transporting and transforming solids and liquids. The presence of damp phlegm here led to obstruction of the chi mechanism of the middle burner, kaya merong epigastric fullness, and it also showed itself in the copious nasal discharge and slippery pulse. Damp phlegm blocks the circulation of chi and blood in the channels, collaterals, and muscles. So this contributed to the one-sided feeling of weakness in the body. Swollen or uneven tongue sides often indicate insufficient nourishment of the channels, collaterals, and muscles. The underlying cause is deficiency of spleen, qi, and yang, so there will be dampness, or this is aggravated by external dampness or cold dampness. Patients with this condition, they should change their diets and abstain from vigorous exercise. Okay, thank you very much. Next, we go to diagnosis by interrogation, and let's call on Ma'am Vina Pascua, straight from Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, mental, emotional symptoms, day 12 na po tayo at continuation po ito nung last week, sadness and grief po. So, meron po tayong case history dito. A 57-year-old woman presented with the main complaint na sumasakit po ang kanyang dibdib. As she was speaking, nung nagsasalita siya, sabi ng author na observe daw niya sa kanyang mga mata were quiet, lusterless, o sa Tagalog, walang kinang, and lacking in shell. This always points to an emotional origin of the problem. So, tinanong daw niya how long she had the chest pain. At sumagot siya na it had started after her husband's death a few years before. Ang kanyang dila po ay swollen with a red tip and her pulse was slightly slippery but very slightly tight on the lung position. Ang diagnosis po nito ay this is a very good example of the effect of grief. Kasi ito yung motion of the lungs. So, kalungkutan po yan. The grief from her husband's death had initially caused a deficiency of the heart and lungs. With time, this had caused some stagnation of qi sa dalawang organ na to. The stagnation of heart qi manifested with a red tip of the tongue, and yung stagnation naman ng qi sa both heart and lung, ito yung nagsanhi po ng kanyang chest pain. As this condition was long-standing, the depletion of the simultaneous stagnation of lung qi had disrupted the movement and the transformation of qi and fluids, giving rise to some phlegm in the chest na nag-contribute naman sa sakit ng kanyang dibdib. The phlegm was indicated by the swelling of the tongue and the slippery pulse. Yung patient po had an interesting emotional reaction to the treatment, which is worth reporting. So, ang ginamit daw niyang simple treatment, ang needling pericardium 6 on one side. Then lung 7 naman sa kabila, REN 12 and stomach 40 ang ginamit pa. And then a few days after the treatment, she went to the graveyard to visit her husband's grave for the first time since his death at Umiaksha. She had obviously repressed her grief for many years. And dahil nga ito yung sanhi ng stagnation ng chi of the heart and lungs in the chest. So maganda po yung iiyak. Another emotional reaction a few days after the treatment was that for the first time, naka-experience po siya ng anger at work. This is also interesting as just there is a controlling relationship between wood and metal. There's one between their allied emotions, anger and sadness, okay, grief. Obviously, the release of chi stagnation in metal had stopped excessive control of metal over wood and lead to an explosion of anger. Moreover, each emotion can counteract another across the reverse controlling uh, cycle of the five elements. Yung anger would counteract sadness, yung metal. At saka yung joy, fire. It counteracts fear. And water, pensiveness, earth counteracts anger, wood, and others. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Next, we go to pulse diagnosis. Let's listen to Ma'am Mildred once again. Good afternoon, Ma'am Mildred, ulit.
Good afternoon po. Good afternoon po muli sa ating lahat. Pulse diagnosis, number 95, punta na po tayo sa deep pulses. Deep pulses po, the clinical significance of the deep pulses is that the imbalances in the interior. So the imbalances can be both deficient or excess, Shu or Shi, in nature. The pulse can be deep because it lacks yang and chi to lift it up to the surface, or there may be excess shi chi. Ito po yung yung pathological factor sanhi ng sakit, which inhibit chi and blood, sui and yang from lifting the pulse upwards. The difference between a deficient condition and a stagnation will be felt by the pulse being either without strength or being forcefully, respectively. The 4 deep pulses are deep, weak, hidden, and confined. Deep pulses, so the deep pulse will be felt when you have a press down from the superficial level. So, ididin po natin from the skin, ididin po natin. And will only be felt in the middle and or deepest level. And when the strength of the pulse is increases as you press down and decreases again upon releasing the pressure of your fingers. So, yung deep pulse po, gano'n natin nararamdaman. Pag pinipress mo, pagkatapos sa balat, padiin, then pag nirelease mo, para siyang nawawala. So, that the pulse is deep is not enough for information in itself, and it must be coupled with other qualities before it can be used diagnostically. So, if the pulse lacks strength, it will be because there is not enough chi or yang to rise the pulse upward. If it is forceful, it is because chi and yang are blocked by cold, food stagnation, chi stagnation, blood stagnation, or stagnation of fluid. So, yun po yung mararamdaman natin pag malakas yung pulse. The speed of the pulse will also determine whether it is hot or cold condition. So, pag mabilis po, heat. Pag mabagal ay cold. So, yung deep pulse po, ang pattern of imbalance, the imbalance is in the interior. So, sa loob na po, loob na ng katawan. Pwede pong yang deficient, o chi deficient, chi stagnation, food stagnation, or may phlegm, may dampness, or may sweat, or blood stagnation, or may cold. Yun po yung mga dahilan na nakakapan natin kung ang pulso ay deep. So, yung typical combination po niyan, pag deep po at saka slow, malalim at mabagal, dahil po ito sa internal cold. May nakapasok ng lamig sa loob ng katawan. Deep and rapid, internal heat po yan. Deep and forceful, internal excess condition. Deep and without strength, internal deficient condition. So pag deep po at saka tight, ito po ay, yung internal po natin ay meron ng stagnation. Pag deep po at slippery, may phlegm. So pag deep and fine, dampness po yan or chi and blood deficiency. So yung weak pulse po, the weak pulse is felt only in the deepest level or the pulse feels weak in depth and decreases even more when pressure is released by the fingers. So yun yung weak pulse po, pag diinan mo, mas nararamdaman mo dun sa pagdiin. Pag nirelease mo, nawawala siya. The weak pulse lack force and when the tips of the fingers are rolled back and forth, it feels narrow. Yung parang malawak pag nirelease mo na. This is because there is either not enough U1 Qi, kulang na po yung U1 Qi na galing sa kidney, or kulang yung blood para ipunuin yung vessel or because siyang is so weak. So, hindi na po niya ma-push outward or upward. Kaya po nagkakaroon ng weak pulse. So, yung weak pulse po, pattern of imbalance, ang mga dahilan po pwedeng Qi deficient, blood deficient, or yang deficient. So, pag weak, deficient po yan. Typical combination po, weak and slow, yang, shu, cold. Weak and choppy, blood and Qi deficiency. So, yun po yung ating mga pulse. Thank you po.
Thank you very much, Ma'am Mildred. Tuloy-tuloy tayo. Let's now proceed to differential diagnosis. And we present to you Ma'am Needs You, who is now in Cavite. Good afternoon po, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, everyone. How's my audio, Doc? Medyo
Clear.
maingay dito sa lugar ko. Nandito ako
Nabablock
sa 13,
yung
Doc, ngayon. Doc,
okay.
nandito ako sa 13, sa may hagdanan.
Okay, grabe.
Ang ingay, maingay kasi.
Hindi siya naririnig. Maganda yung mo, nabablock na yung noise.
Maganda yung earphone ko. Okay po, Doc. So, today, welcome everyone in our TCM Foundations, number 196. Okay? Ang etiology o yung mga dahilan kung bakit tayo nagkaroon ng ganito. Exposure to climatic wind and heat. Okay. Thomas, dry cough without phlegm or with sticky phlegm, not easily expectorated. Hindi version to cold, fever, dry throat, tickly throat, makati-kate, dry nose, dry lips, discomfort in the chest. Kita mo ay floating. Yung tongue naman, kapag tinignan mo siya ay red with yellow or white fur or white coating. So, treatment principle, clear dryness, moisten lungs, suppress cough, transform phlegm. Okay. Acupuncture treatment points, lung 7. It releases the exterior, expels wind. SJ5, triple warmer 5, expels wind, releases the exterior. Spleen 6, supplements the body's yin. Bladder 13, supplements lung qi. LI4, releases the exterior. REN 12, descends repeat. Bladder 12, gamitan nyo ng cupping to expels the wind. And kidney 6, this inhibits the throat. Neither technique ay with drainage. So para sa mga generalized sweating and aversion to cold, drain the bladder 12, GB20, and bladder 11. Thank you everyone. Thank you, Doc Hector.
Thank you very much, Ma'am Needs. Ingat po kayo dyan sa 13 Martires. Next, acupuncture patterns and practice. Okay, so we are starting with a new topic, subcostal pain, below the rib pain. Okay. This is defined as the pain below the lower ribs on one or both sides of the waist or upper abdomen. The etiology and pathology. The liver is located on the right side of the subcostal region, and its main and collateral meridians distribute to both sides. The gallbladder attaches to the liver. So the main pathology of subcostal pain is related to the liver and the gallbladder. However, pwede ring ma-involve ang spleen, stomach, and kidney. Subcostal pain may be brought on by external pathogenic factor or by internal injury. The key mechanism is liver failing to regulate qi movement and disharmony in its main and collateral meridians ng liver. No? Illnesses that present with subcostal pain may be excess or deficient. The main illnesses ng excess are qi stagnation, blood stasis, and exogenous dampness heat. The main illness of deficiency is depletion of essence and blood. Let's start with stagnant liver qi. Pent-up passions or rage can injure the liver. So this is something very, very important for those who can relate. So when this happens, the flow in the meridians and channels of the liver becomes impeded. Liver qi becomes stagnant, and this leads to subcostal pain. Blood stasis blocking the channels. Qi is commander of blood. When qi flows smoothly, blood circulates normally. When qi movement is impeded, blood flow becomes sluggish. Kaya we always stress the importance of having regular acupuncture treatments, no? To keep the qi flowing, diba? To keep the blood flowing, because we improve the qi. If impedance of qi movement persists for a long time, blood stasis develops and blocks the channels in the subcostal region. So we have subcostal pain. This can also result from direct traumatic injury to the subcostal region. Gelling of dampness heat in the liver gallbladder. Dampness, whether exogenous or endogenous due to improper diet injuring the spleen, may lodge in the interior, gel, and this give rise to heat. Gel dampness and heat can attack the liver and the gallbladder, impairing their ability to regulate qi movement. So this leads to subcostal pain. Deficiency of liver in. Protracted illness or chronic overstrain may consume essence and blood, leading to their deficiency. And if you have deficient essence and blood, you will have subcostal pain. So in such circumstances, the water element is unable to nourish the wood element. Excessive intake of acrid and drying herbs that regulate qi can actually induce liver yin deficiency and failure to nourish liver meridians and channels. This also induces subcostal pain. Clinical manifestation. Subcostal pain, whether one-sided or two-sided, may show several patterns. It may be distending in quality, migrate without fixed location, and radiate to the shoulder or upper back. Pwede siyang stabbing or prickling in quality, fixed location, and accompanied by guarding. It may be vague and lingering in quality. In the initial stages, subcostal pain tends to be relatively severe. After a while, it tends to become vague and intermittent. Subcostal pain may be accompanied by epigastric pain, distension, or subcostal mass. Thank you very much. Next, we go to signs and symptoms. Let's listen once again to Ma'am Vina Pasqua. Ma'am Vina Pasqua, hello ulit. Good afternoon po.
Signs and symptoms po tayo, day 88. At continuation po ito last week, blurred vision and floaters. So pag full po, turbid phlegm in the head. My blurred vision po and or floaters, dull headache with a feeling of mabigat po ang pakiramdam and massiness of the head. Poor memory and concentration. So nahihilo din siya, may sputum in the throat, a feeling of oppression sa kanyang dibdib, nausea, at ang kanyang dila ay swollen with sticky coating. At ang pulso ay slippery. Ang ginagamit po na points dito ay stomach 40, REN 12, REN 9, REN 5, bladder 22, at saka LI4 po. So next po tayo, other patterns. Pag liver yang rising naman, blurred vision o kaya floaters often occurring during a headache attack. So masakit ang ulo, nahihilo, may tinnitus, irritability, propensity to outburst of anger, at saka ang pulso po ay wiry. Then heart blood deficiency, blurred vision and or floaters, palpitations, dizziness, insomnia. Ito yung nagkakaroon ng dream, disturbed sleep, poor memory, anxiety, propensity to be startled, so madaling magulat, dull pale complexion, pale po ang lips, at saka ang dila po ay pale at saka thin, choppy or fine pulse, kasi nga may blood deficiency. Pag liver fire naman, blurred vision, bloodshot eyes, masakit ang mga mata, masakit ang ulo, pula po yung mukha, dizziness, tinnitus, irritability, propensity to outburst, bigla siyang magagalit. Thirst, yung panlasa po ay mapait. Constipation, dark po ang urine, pula ang dila, pero mas red sa side, kasi nga sa liver. And dry yellow coating. Ang pulso po ay wiry rapid. Then next naman ay heat in the gallbladder. So nagkakaroon din siya ng blurred vision, dizziness, tinnitus, bitter taste, dry throat, irritability, red face, at saka pati yung tenga. May hypochondrial fullness, unilateral or bilateral yellow ang tongue coating. And then ang pulso po ay wiry rapid. Next po ay deficiency of minister fire. Ito yung kidney yang deficiency. So meron din siyang blurred vision and or floaters, watery eyes, lower backache, yung mga tuhod po ay malamig, sensation of cold in the lower back, at nakakaramdam din ng patient ng nilalamig siya. Mahina ang mga legs, bright white complexion, weakness, tiredness, lassitude, abundant clear urination, scanty clear urination, so sa gabi, urination at night, infertility in women, impotence naman, premature ejaculation, decreased libido, pale and wet tongue, at saka yung puso po ay deep weak. Last po tayo ay spleen chi deficiency, blurred vision and or floaters, tired eyes, poor appetite, slight abdominal distension pagkatapos kumain, nakakaramdam po ng pagod, lassitude, pale po ang complexion, at mahina ang mga limbs, loose stools, slight depression, at may tendency to obesity. Ang dila po ay pale at saka ang pulso po ay empty. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much po, Ma'am Vina. Okay, from signs and symptoms, we now proceed to lump clinics, and we are still on BPH. Okay, and this time we talk about the patterns for benign prostatic hyperplasia. The patterns that we will discuss are blood stasis, damp phlegm, kidney and spleen yang deficiency, liver and kidney yin deficiency, stasis of essence, liver chi stagnation with damp phlegm. Blood stasis. There is decreased urinary flow, nocturia, hypogastric pain, pain in the perineum, prostate feels hard on rectal exam. Tongue is purple, pulse, wiry, choppy, or firm. And then we have the prostate. The prostate pulse is wiry. So I don't know if you're familiar with rectal exam, no? Because when you have male patients and they complain of, if their chief complaint is very pathognomonic of a prostate problem, we always do a rectal exam. So we also have to feel the prostate pulse. Treatment principle: invigorate blood and eliminate stasis, soften hardness. Points: liver 3, spleen 10, bladder 17, kidney 14, spleen 4 on the left, kasi lalaki, di ba? So we start with the left, and then pericardium 6 on the right. So this is for the penetrating vessel. Ren 2, bladder 32, bladder 34. Even method. Liver 3, spleen 10, bladder 17, and kidney 14, invigorate blood and eliminate stasis. Spleen 4 and pericardium 6 will regulate the penetrating vessel and invigorate the blood. So please remember that if you want to invigorate the blood, we regulate the penetrating vessel by using spleen 4 and PC6. Ren 2, bladder 32, and bladder 34 are used as adjacent points for the prostate. Next, damp phlegm. Urinary difficulty, turbid urine, painful urination, micturition, stopping and starting, hypogastric heaviness, feeling of heaviness at the perineum, tongue swollen with sticky coating, pulse, slippery, prostate pulse is slippery. Treatment principle: resolve dampness and phlegm, tonify the spleen. Points: lung 7 on the left and kidney 6 on the right. Stomach 28, bladder 22, Ren 3, Ren 5, Ren 9, Ren 12, and bladder 20. So for damp phlegm, we use even method, except the last 2 points, which should be tonified. Lung 7 and kidney 6 naman will regulate the directing vessel or the Ren, no? Lung 7 and kidney 6. The directing vessel is used in this case because it helps to regulate the triple burners, transformation, and excretion of fluids. Stomach 28 is an important point to resolve damp phlegm in the lower burner. Bladder 22, Ren 3, Ren 5, resolve dampness and phlegm from the lower burner. Ren 9, general point to resolve dampness and phlegm. Ren 12 and bladder 20 tonify the spleen. Now let's go to kidney and yang, spleen yang deficiency. Urinary frequency, slight incontinence, dribbling, urgency, cold legs and knees, lower back ache, dizziness, tinnitus, tiredness, depression, loose stools. Tongue is pale, pulse is deep, weak. Treatment principle: tonify and warm the spleen and kidneys, resolve dampness from the lower burner. The points: bladder 20, Ren 12, bladder 23, kidney 13, Ren 4, SI 3 with bladder 62, Ren 3, spleen 9, kidney 12, bladder 32, bladder 34. Reinforcing method: MOXA applicable. Bladder 20 and Ren 12 tonify the spleen. Bladder 23, kidney 13, and Ren 4 tonify the kidneys. SI3 with bladder 62 will regulate the governing vessel. Ren 3, spleen 9, and kidney 12 resolve dampness from the lower burner. Bladder 32 and bladder 34 are adjacent points to affect the prostate. Thank you very much. And we are now ready to answer your questions on the chat box. So We'd like to thank everyone for joining, especially our presenters. Good afternoon, everyone.